Okay, it's my patient Sylvia, and I'd like you to just tell me about your experience since you've been here with your knee pain and your wrist pain. A little bit about yourself. You play the accordion,
Yes.
and so you need to use those wrists, and you dance around. You got to use your knees. Tell me about what your experience has been.
Well,
What it was like when you first came in.
Well, when I first came in, I came in just because I wanted to have something that was going to help pain, because I was in such pain with my knee and everything. And I just kind of casually mentioned that I only need this medicine or something that's naturopathic. I didn't want to be taking Mobic or something that was going to cause a lot of side effects. And said, well, until I can get knee surgery, unless they come up with something with stem cells, because I heard about that they do that. And Dr. Hansen put this little smile on his face and he said, we do that. Oh, I was so thrilled. This was on a Monday. I couldn't do anything the next day because I had a dance to play for, but I was here on Wednesday and we started. I mean, when he said that, I thought, let's go for it. So, and I am so happy I did. This has been a terrific experience, and I can't hardly believe that I can move around and bring my leg up and get off a chair in a normal fashion now, because when I came in here, I was limping and just miserable.
Yeah, it looked very painful when you would stand up. It took you a long time to stand up. You walk with a limp slowly down the hall. Now you jump up and come down the hall. And
I know, it's a miracle.
Can I look
I'm
at
going
these
to call
knees?
you a miracle, Dr. Hansen.
These knees, see, this is the knee that we treated. Her left knee was so swollen you could barely tell it was a knee. Now it looks almost exactly the same as her right knee. Just a teeny bit of swelling there now. And now you said you can get down on your knees. Like you couldn't get down on your knees before?
I've been down on my knees for 7 or 8 months. No, this was so swollen to begin with. They took 33 cc's of fluid off of it. I had cortisone, then I tried the rooster comb stuff in there. Nothing was working, and I thought, okay, I'm going to have to have knee surgery, I guess, down the road. But I don't have time for it. I'm a musician, you know?
Right.
Plus, I like to polka dance.
So we did one injection once a week for 10 weeks. And how do you feel now?
I feel I'm 95.9% better.
It's amazing. It's wonderful. And it has continuing effects because it is your own platelet-rich plasma. It does have the stem cell stimulating ability. Those platelets stimulate your own stem cells to come to the area. It builds up the growth factors that build collagen. So there's fibroblast growth factor and platelet-rich growth factors, platelet-rich plasma growth factors that just stimulate that collagen. You make your own cartilage. It builds it up, gives you that cushion, that strength, that flexibility again.
And I shouldn't have to do this all over again.
Right.
It's going to be permanent. That's what I like. And I didn't have to undergo a surgery and anesthetic and follow-ups and all that other stuff. And I mean, this is the way to go. I'm so pleased to have the near healthy knee, and it will be, I'm sure.
And we're happy for you. And tell me about your wrist. We also worked on your wrist.
The wrists were the shock of my life, because I was fine till I came down here, and then all of a sudden they start swelling up and hurting, and pain shooting up from my right wrist all the way up to my elbow. I wake up in the morning and this ache was all with, and the left one got really puffy on the back side of my hand, and what's going on here? I mean, you know, I'd had arthritis 7 years ago, and it went away, basically. I really did some things then that I thought were helpful, and I had thought all under control. I'm playing, my fingers are moving beautifully, and the fingers still were moving okay, but
your thumb mainly was
it was the lower thumbs on both sides that were just painful as could be. And so I'm having the injections there. They've been slower to get well than the knee has in a way, but they're doing much better now. They're not aching. There's no pain. And once in a blue moon, if you know I'm doing something, I shouldn't pick something heavy, or I still get a little pain in there. But I'm sure that by the time all of these 10 injections have taken done their thing, I'll be fine. I'm just thrilled now because I can play my accordion and
They were
do
a
what I
lot
need to do.
more swollen too when we started. Now you don't see any
No,
swelling.
there's no swelling. There's no swelling.
They're different because they're smaller joints. They're a little more difficult to treat. We can't use the platelet-rich plasma, but we use another combination of natural and non-steroidal anti-inflammatory medicines that I was trained how to use in Paris, France, by the pioneer of mesotherapy who really developed it, and phenomenal results. So yeah, it'll have continuing effects. About a month after you finish your last treatment, it'll still be building, sometimes a couple of months later. So you can look forward to that keep getting better.
Okay.
All right.
You made me a happy camper.
All right, we're glad for you. Thanks.
Thanks.